Did you know that breast cancer don't always start with a lump? In fact, some of the earliest warning signs and changes many people overlook. Your breast is fascinating. It sits on your chest wall, so it changes throughout your life in response to your hormones. It changes during your puberty, it changes during your menstrual cycle, it changes when you are breastfeeding, and also it changes during your menopause period. So in this video, I'll be discussing 8 signs of breast cancer. 8 warning signs on your breast you shouldn't ignore. Hi guys, welcome back to my YouTube channel. It's your girl Pristel, and if you're new, you are welcome. Thank you so much for joining this family and building. Please click on that subscribe button and turn on your post notification bell so you won't miss any of my video. And for my old subscribers, thank you so much for always returning back. Thank you. Alright guys, without further ado, let's dive into the video. Breast cancer occurs when the breast cells mutate and grows out of control. And if breast cancer spreads, it typically goes to a nearby lymph node under the arm first or around the collarbone. But if it spreads beyond these small glands to other parts of the body, then it is called metastatic breast cancer. And metastatic cancer is incurable. So early detection, early diagnosis is very important. But note, most breast changes are due to hormonal changes, so they are nothing to worry about. But if you are experiencing the symptoms I'm about to mention, you need to see your doctor immediately, even if it seems mild. Alright, moving on to the signs and symptoms of breast cancer. Sign number 1, inverted nipple. An inverted nipple is when the nipple suddenly turns inward instead of pointing outward. But note, some people are born with it naturally. Yes, some people are born with an inverted nipple naturally, and it is completely normal for them. But you, since they gave birth to you, all your life, your nipple have been pointing outward. But all of a sudden, you start noticing that your nipple is turned inward. Then it could be a warning sign, and you need to see a healthcare professional. Sign number 2, flaky rash around the nipple. So if you notice a dry, scaly, flaky, crusty rash, or even something similar to an eczema around the nipple, and you have used regular cream, you have used treatments, you have self-medicated, and it's not going away, it should be checked by a healthcare professional, because it can be linked to a rare form of breast cancer called Paget's disease of the breast. Sign number 3, dimpling. Dimpling is when the skin of the breast develops small dents or pits, making it look like the surface of an orange peel, just like this picture. So if you notice any new dimple that were not there before, it is important to get them checked by a doctor. Sign number 4, redness and heat. So if one of your breasts suddenly becomes red, swollen, warm to touch, or even inflamed, don't ignore it. While infections can cause these symptoms, they can be a sign of a rare and aggressive type of breast cancer called inflammatory breast cancer. So you need to see your doctor immediately. Sign number 5, nipple discharge. Nipple discharge is a fluid that comes out from the nipple when you are not breastfeeding. The discharge may be clear, yellow, and sometimes bloody. And if it comes out from only one breast, then you need to see your doctor immediately. Sign number 6, changes in the size or shape of the breast. Pay attention to your breast. If one breast suddenly becomes larger, swollen, smaller, or changes in shape without an obvious reason, see your doctor. You need to see your doctor. Sign number 7, tethering. Tethering happens when the skin of the breast appears to be pulled inward or attached to a tissue underneath. So instead of the skin of the breast to move freely, it looks stuck in one area or one place. This can occur when the cancer cell grows to a nearby tissue and creates a pulling effect on the skin. So you need to see a healthcare professional. Sign number 8, which is the last sign, breast lump. A breast lump is one of the most common signs people associate breast cancer with. The lump may feel hard, irregular in shape, and usually doesn't move easily under the skin. However, not all breast lumps are cancerous. Some are harmless cysts or other benign conditions. That is why a new lump should be examined by a doctor. Early detection saves lives, so make it an habit to check your breast regularly and seek medical advice whenever something doesn't seem right. Alright guys, thank you guys for watching. Thank you guys for listening. And if you found my video helpful, please click on that subscribe button, like, share, and comment. I will see you guys in my next video. Bye.